No one thought they were immune. It was only a matter of time. The Omicron wave has hit the West Midlands, and New Cross Hospital in Wolverhampton is treating its victims.
The younger patients predominantly that are coming through to COVID wards are the ones who have not been vaccinated.
There were 27 patients last week. Now there are 100, and ward space is at a premium.
In the last week, we have seen a sharp increase in the number. So while we had only one ward looking after COVID patients, the Trust had to open up more than one ward.
But it's not just the number of COVID patients that's causing the problem, it's the indirect effect of COVID that means places like this are struggling. From staff sickness to bed shortages to dealing with the backlog, it's a multitude of reasons which are not going away.
Ringing to see if one of your beds is ready yet for one of our patients.
On the acute ward, Rashpal is used to juggling bed space.
How many patients have you got waiting?
1, 2, 3, 4, 5, 6. It's about 26 at the moment.
26 patients waiting
from
to come up
ED.
here from A&E.
What she's not so used to is having to do this with 11% of her colleagues across the hospital either off sick or isolating.
So you're not operating full staff?
No, we were short today, but we've managed to sort it out, and people have come in to help us today.
You've called people in today?
Yeah.
In fact, COVID-related staff absences more than tripled in the last month in England, rising from just over 11,000 to more than 39,000. 16% of hospital beds were taken up by patients staying for more than 3 weeks, adding to pressures on bed capacity, which, not including critical care, were at 91% during the same time.
2 of the patients cannot be taken by Athol today due to extreme staff sickness.
In her third meeting of the day, Louise is trying to discharge dozens of patients into care homes, but half of them in the area are closed because of COVID.
We have 131 patients in the Trust who are medically fit for discharge. We're unable to discharge them safely into the community.
So you're a bit like a balloon at the moment. You are filling up from the bottom. You're getting bigger and bigger and bigger. Do you think at some point you're going to burst?
At present, we're managing. I don't know how long we can manage as we are at present.
NHS England is trying to boost capacity by building temporary Nightingale wards in car parks, but the Chief Medical Officer here doesn't think that is the answer.
Our main issue is actually how do we staff that? Because we're struggling to staff all our inpatient areas at the moment. So realistically, we need to get people out of beds the way we can staff at the moment rather than adding more capacity that will just be really difficult to staff.
This hospital hopes it won't need the army to help out. It's doing all it can to avoid it, but nothing, of course, is guaranteed. Emily Morgan, News at 10 in Wolverhampton.